I want to focus on 4 critical signs that may indicate a stroke is happening. A stroke occurs when blood flow to part of the brain is disrupted or blocked, and brain cells start dying within minutes from lack of oxygen. Recognizing a stroke quickly and getting emergency care can make the difference between full recovery and permanent disability. I'm not a doctor, but I want to explain these 4 signs in everyday terms so you know what to look for and why they're so important. The first sign is sudden numbness or weakness, especially on one side of the body. You might feel your arm suddenly getting heavy, as if it's asleep. Maybe you try to lift a cup, and it slips from your grasp because you can't grip it properly. Another tip-off is when one side of the face droops, particularly around the mouth or eyelid. You can ask someone to smile. If it's crooked or only half the mouth moves, that's a potential red flag. This weakness or numbness can also happen in the leg, making walking difficult or causing a sudden stumble. Because the brain controls the opposite side of the body, a stroke in the right side of the brain often affects the left side of the body, and vice versa. The key is that this symptom appears out of nowhere. One minute everything's fine, and the next you can't move or feel the same way. The second major sign is trouble speaking or understanding language. When someone has a stroke in the brain areas responsible for speech, words can come out slurred or entirely jumbled. You might ask a simple question and receive a confusing or nonsensical answer. In other cases, the person may go suddenly silent or look baffled, unable to comprehend what's being said to them. This communication breakdown can be terrifying because it disrupts something most of us take for granted. If you notice someone struggling to repeat a simple phrase or piece together coherent sentences, consider a stroke as a serious possibility. Don't assume they're just tired or distracted. Act on it immediately by calling for help. The third important warning sign is abrupt vision changes. A person may lose vision in one eye or experience blurriness or double vision without warning. Some people describe it as a curtain descending over part of their vision. Others might see 2 overlapping images where there should only be one. If you're talking to someone and suddenly they start squinting or turning their head at an odd angle to see you, ask if their sight has changed. Another clue is if they can't track movement or seem unable to recognize you from a short distance. While vision problems can have many causes, a stroke-related change often arrives out of the blue and may appear alongside other symptoms like confusion or numbness. Because the brain's visual centers can be affected by any disruption in blood flow, abrupt eyesight loss should never be ignored. The fourth sign to watch for is a sudden, severe headache, often described as the worst headache of a person's life. Unlike typical headaches or migraines, this one can feel like an explosion of pain, striking so quickly that it leaves no room for doubt. In hemorrhagic strokes, where a blood vessel ruptures in or around the brain, the pressure buildup can trigger an intense, stabbing headache that can be accompanied by nausea, vomiting, or dizziness. A headache this powerful may make someone cry out, clutch their head, or drop to their knees from the shock of the pain. If you see someone experiencing this kind of extreme headache with no apparent trigger, assume it could be a stroke and seek urgent medical attention. The key difference here is the sudden onset. Migraines often develop more gradually or have early warning signs, while stroke-related headaches can come on like a bolt of lightning. Now, these signs can appear together. For example, someone might have facial droop plus slurred speech or blurry vision. Even if they insist they're fine, don't wait. Time is critical. In strokes, every minute counts because doctors only have a narrow window to use treatments like clot-busting drugs. If you suspect a stroke, call emergency services right away rather than driving yourself or someone else. Paramedics can start treatment on the spot and warn the hospital so a stroke team is ready. Keep track of when the symptoms began. That detail helps doctors decide on the best course of action. They'll do tests like a CT scan or MRI to see whether there's a clot or bleeding. Treatment varies greatly depending on the cause, so quick diagnosis is essential. Other symptoms, such as sudden dizziness, balance trouble, or confusion, can also indicate a stroke, but the big four, weakness/numbness, speech difficulties, vision changes, and a severe headache, are the clearest warnings. Strokes can happen at any age, though the risk is higher for those with high blood pressure, heart conditions, or a history of smoking. Still, no one is completely safe from a stroke. If you see someone showing these signs, don't hesitate. Call for help right away. In the best case, it'll be a false alarm. But if it's a real stroke, fast action might save a lifetime of complications. Whether it's one-sided weakness, sudden speech problems, abrupt vision loss, or a crushing headache, treat these as urgent cues to call emergency services. Staying alert to these signs can help protect you and the people around you from the devastating consequences a stroke can bring.